If you've ever felt a sharp locking pinch deep in the front of your hip when you squat down, climb a flight of stairs, or even just sit for a long time, you might be dealing with something called femoroacetabular impingement, or FAI. We call it hip impingement syndrome. It's a common condition, especially in active people, and today we're breaking it down in 6 minutes along with all the great non-surgical ways that we can fix it. FAI happens when there's an abnormal shape to the hip bones. Instead of a smooth, perfect fit, the ball or the socket has an extra bump, causing them to literally impinge or bump into each other during movement. There are 3 types: cam, a bump on the ball; pincher, an extra lip on the socket; and the most common, mixed. This is bumping stresses that irritate the cartilage, particularly the labrum, which is why FAI often goes hand in hand with painful labral tears. The key is that the pain comes from a mechanical issue, bone hitting bone or bone hitting the labrum. So simply resting it often doesn't make it go away for good. We need to change how you move and how the joint functions. For FAI, the goal is to create more space and avoid that mechanical pinch. Physical therapy is the absolute bedrock of FAI treatment. A PT will identify the specific movements that cause the pinch and teach you how to use your muscles, especially your glutes and core, to stabilize the joint and move around the bony abnormality. This is called neuromuscular retraining. Chiropractors play a crucial role by ensuring that your pelvis is balanced. When the pelvis is out of alignment, it can change the angle of the hip socket, making the impingement worse. A specific adjustment can instantly reduce tension and improve joint mechanics. And massage therapy is vital here as well. With FAI, the muscles around the hip, especially the hip flexors and the inner thigh, can get incredibly tight in an attempt to stabilize the joint. Massage can release that tightness, immediately improving mobility and reducing the drag on the joint. Since FAI often damages the labrum or the joint lining, these advanced therapies focus on retraining that soft tissue. Regenerative medicine, particularly PRP, is key for FAI with labral involvement. Injecting growth factors into a torn labrum or the surrounding inflamed tissue can accelerate and repair the process and reduce chronic inflammation caused by the impingement. For general hip inflammation and pain, cold laser therapy is a great non-invasive option. It calms the irritated tissue right where the pinching happens, providing quick pain relief and improving the cellular healing environment. Now, is shockwave used for SAI? Yes, but typically not directly on the joint. It's fantastic for treating the secondary effects, like the stubborn hip flexor tendinopathy or gluteal tendinopathy that often develops due to the body compensating for the impingement. And remember peptide therapy. Specific peptides can assist in reducing inflammation and promoting the healing of connective tissue, which can be an excellent adjunct to help the labrum and surrounding structures recover from the constant irritation. The goal with FAI isn't always to get rid of the bump. That's often going to require surgery, but to teach your body to function perfectly with the bump. A combination of PT for movement, chiro, massage for immediate relief, and regenerative techniques to heal the damaged tissue gives you the best shot at staying active and pinch-free. Up next, we tackle one of the most common issues, osteoarthritis of the hip, the wear and tear condition. We'll show you how to manage it and keep your joint healthy for decades. Don't live with the pinch. Get the help you need. We'll see you in the next video.